Okay, so again, my name is Tatiana, and today I'm going to be presenting on cultivating calm in children and adolescents who experience or are diagnosed with anxiety. Uh, and so we are located in New Jersey and Pennsylvania, and Capital Health Behavioral Health Specialist provides or offers psychiatry services, TMS, and both group and individual therapy. So to get us started, let's define anxiety. Anxiety is an intense, excessive, and persistent worry and fear about everyday situations that can be accompanied by a variety of symptoms. And we'll definitely take a look further at that in a few moments as we discuss the different types of anxiety that children experience. And like adults, children can also have other anxiety disorders, and that can range from separation anxiety and obsessive compulsive disorder, or OCD, to panic attacks. And unfortunately, if they are left undiagnosed and untreated, an anxiety disorder can worsen over time, and it can cause really significant disruptions to a child's life. And some signs of anxiety are a bit easier to spot than others. And children oftentimes don't really understand their anxiety or what's causing it. And because of this, they can display a variety of behavioral or physical symptoms. And that can be pretty difficult for parents or other adults to pinpoint, like teachers or other caregivers, grandparents, or what have you. And we are going to take a look at some of the different types of anxiety and the symptoms associated with them as well. So when we think about potential triggers or causes of anxiety, some things that come up are new situations that take children out of their typical routine, including a new caregiver, maybe a new sibling, a recent move, if we think about all the transitions that have just taken place over the past year, right? We can also look at family difficulties, marital problems, financial issues. Oftentimes when parents are in situations where stress is increased within the home, it can impact or affect the children as well. And then we can't really shy away from like a family history. So if anxiety or other mental illness is present, then that can also be an external link. Okay. So there are various signs of anxiety in children that include things like moodiness, behavioral changes like aggression, or maybe frequent crying spells. And we also see issues with regard to like sleep hygiene, changes in appetite, fear, like fear of the dark, being away from home, or interacting with peers. And at this point, I am going to switch gears a little bit just to kind of provide some information on the different types of anxiety that we do see in children. Okay. So separation anxiety. It involves an exaggerated fear of being separated from parents and caregivers. And this type of anxiety is really common in young children, but it usually begins to subside once the child is around 3 or 4 years old. And the symptoms of separation anxiety are usually very easy to spot and involve things like refusing to go anywhere without the parent or the caregiver, refusing to sleep alone, or maybe refusing to go to school even. Some of the symptoms that are associated with separation anxiety include headaches, excessive fears or worries that something will happen to either the parent or the child once the two separate, or flatly refusing to participate in separate activities, and sometimes even like inconsolable crying for the duration of the separation. Children with generalized anxiety experience excessive and unrealistic worry and fear about everyday things. And they often anticipate disaster or worst case scenario. And I'm not sure if any of you have ever experienced that, or if your child has ever come to you with those types of worries, but I would encourage that you just try and be mindful of that too. So children with generalized anxiety may also have somatic symptoms, and that's more on the physical side. So they experience headaches, abdominal pain, and maybe muscle aches and muscle pains. And there can also be symptoms such as difficulty concentrating, irritability, and restlessness. So obsessive compulsive disorder, or OCD, right? When experiencing obsessive thoughts, which are a characteristic of this disorder, it can lead to severe anxiety. And the compulsions or the rituals performed are usually an attempt to reduce the anxiety caused by the obsessions. And so obsessions are thoughts, images, or ideas that won't necessarily go away. They're unwanted and can be extremely distressing or worrying. And some common obsessions among children include extreme worry about bad things happening or doing something wrong, a preoccupation with order, symmetry, worries about getting sick, other people getting sick, or feeling like things have to be done just right. So compulsions are behaviors that children feel have to be done repeatedly to relieve anxiety. And some common ones that we see among children include like excessive hand washing, ordering or rearranging things in a particular way, counting things over and over again. And there may even be elaborate rituals that have to be performed the exact same way at the exact time. So when you think about bedtime rituals or like getting up to go to school or something along those lines. So panic disorders are more common in older children around their teenage years. In most cases, in addition to fear or discomfort, children may also experience a feeling of being detached from themselves, or if not just detached from themselves, like they are having almost like an outer body experience. It's been described to me in that way before as well. And so that can be accompanied by like chest pain, shaking, sweating. There's also physical symptoms associated with that. And they can also take place with specific phobias. So that's when a child may become anxious or worried, but about a very specific thing, like spiders, swimming, being left alone, being in the dark, something along those lines. So selective mutism is another form of anxiety, and it is the inability to speak or communicate in certain settings. And that can include specific social settings, such as school or within the community. And selective mutism can have a number of consequences, particularly if it goes untreated. And it does have the potential to lead to academic problems, low self-esteem, social isolation, and social anxiety. And some of the symptoms include the inability to speak in school or other, specific social situations, speaking easily in certain situations like at home or with familiar people, but not in others. The use of nonverbal communication to express needs, like nodding your head, pointing, maybe a subtle sound, or shyness, right? Fear of people and the reluctance to speak between ages 2 and 4. And there is a direct link between our nervous system and anxiety that affects our level of stress, physical reactions, and the ability to experience pleasure and also to relax. And just to kind of provide a brief overview, I'm going to talk a little bit about the sympathetic and the parasympathetic nervous system. So the sympathetic nervous system is really responsible for your stress response, right? And it activates the fight, flight, freeze response. And with anxiety disorders, the fight or flight response takes place even when there isn't any danger. The parasympathetic nervous system is more so responsible for your relaxation response, and it helps prepare you to kind of rest and calm down. There has been an increase in anxiety in children overall, and we can really contribute that to a variety of major changes and adjustments that have disrupted the norm, including like closing the schools, we've got social distancing, the decrease in social interaction, face masks, among various other things that have taken place. And when thinking about treatment options, we have psychiatry, therapy, or a combination of both have been very successful treatment options for children with anxiety. When engaged in psychotherapy, it is very important that parents are also educated about anxiety disorders, and parental involvement really allows for the therapist to suggest helpful techniques and allow time for the family to kind of process together some of the child's anxious thoughts and feelings in an effective way. Psychotherapy modalities include individual or one-on-one sessions, group sessions, and family therapy, all of which we offer at Capital Health. And some of the interventions used may include cognitive behavioral therapy, exposure and response prevention therapy, and mindfulness. So cognitive behavioral therapy, that's based on the idea that what we think can affect how we act, which can also affect how we feel. And by changing the way that our children think or altering behaviors, we can essentially change the emotions connected to them. Exposure therapy is the basic idea that kids are exposed to things that trigger their anxiety, right? In really small steps. And it's done in a safe setting. And as they get used to each trigger, the anxiety subsides. And then they're able to take on another trigger. The child and myself typically work together to come up with a list of things that are activating. And then they're ranked. It's like a fear hierarchy. So they rank them on a scale from 1 to 10. And then we expose them to the fear that activates their anxiety in like the mildest form possible. And then we build on that. And mindfulness can help children better understand and manage their thoughts and emotions. And it utilizes and combines CBT techniques to do that. So the benefits of psychotherapy for children with anxiety include a plethora of things, right? So you look at the ability to develop and use relaxation techniques, which we'll look at in a little while. Developing positive self-talk to help reduce anxiety, identifying fears and worries, openly sharing thoughts and feelings, which is a possibility in individual and in a group setting, and also increasing coping skills like socialization, physical activity, and self-assurance. How can you help? Parents, caregivers, teachers, just community. There are things that parents can do at home to help children learn how to manage their feelings of anxiety. And some of those options are not avoiding what your child fears. It can offer like short-term relief, but in the long run, it does reinforce anxiety, and the anxiety can actually worsen over time. So we would encourage that you try not to be avoidant. But you can also offer comfort, right? And model positive responses, which kind of looks like listening to your child's concerns, but being really careful not to reinforce the fears, right? Instead, trying to help your child practice relaxation techniques while modeling appropriate and non-fearful responses to the source of your child's anxiety. You can also help by having your child learn to tolerate their fear. So as a form of like exposure, right? Gradually exposing them to the source of their fear while using relaxation techniques to kind of calm their fear response. And it can help them learn to tolerate distress and eventually learn that there isn't anything to fear. And one thing that I always like to point out is that as parents, as adults, as caregivers, our behaviors are modeled. And so the way that parents and authoritative figures cope with anxiety can really affect the way a child deals with their fears, right? And so while I'm not saying that parents should pretend that we don't experience anxiety or adults should pretend that it doesn't exist, I would encourage focusing and showing kids that it's something that can be tolerated calmly and effectively managed. And there is a resource that I really do recommend for parents and caregivers called Coping Cats for Parents. They have very interactive training models, and it does provide parent education on how you can assist your child who is experiencing anxiety. So we spoke a little bit about coping skills, right? And they can look very different, and it does depend on what works for the individual child, because not all children are the same, and we don't necessarily respond in the same way to everything. So let's see. It can look a little like helping your child identify what's bothering them, redirecting their attention by use of healthy distractions, or maybe just taking a moment to pause and to breathe. And one thing that I do find helpful in explaining this is that, you know, sometimes our mind will take us places that we're not physically existing, and then we react to that. And so it's a great idea and a great tool to use when to kind of redirect your thoughts and reorient yourself to the current time and space that you're occupying. And to do that, I encourage, you know, two very, very specific skills: deep breathing exercises. And this one is 4-7-8 breathing. And the goal is really to inhale for 4 seconds, hold for 7, and exhale for 8, right? And to repeat that a few times. And the way I explain it to youth is that it's similar to like the hard reset that we do on a cell phone or a tablet. If you're familiar with like the iPhones and things like that, you have to press some buttons and the phone reboots, right? That's kind of the way that your mind and your body will respond when you pause and breathe. And so that's one way that I explain it to our youth. Another skill that I like to reinforce is grounding techniques or grounding technique. And for this technique, you really want to focus on what's happening around you in the present moment. And so the goal is to get the children to identify 5 things that they can see, 4 things that they can feel, 3 things that they can hear, 2 things that they can smell, and 1 thing that they can taste. And it's a great way just to kind of pull them back to the present moment. And those are 2 of the skills that we utilize in group therapy here at Capitol Health. And so the way group therapy works is that each individual participant is engaged in individual sessions to prepare for the group setting, where they learn coping skills and also the expectations for group. And the group does take place in person for children ages 11 to 13 years old. And each session runs for about an hour to an hour and a half. And the program typically lasts about 12 to 15 weeks. And the goals of this group really focus on some of the things that we've discussed, right? Like exploring and processing anxiety and triggers, connecting with other children who may share similar experiences or symptoms, and then learning and implementing relaxation strategies and cognitive therapy skills. The group has 4 separate phases, and each phase, you know, we participate in 2 to 3 different activities to kind of reinforce a skill associated with that phase. So initially we want to learn, what is anxiety? What does that look like? And then we transition into, how do we act with it anyway? Given the fact that anxiety doesn't necessarily go away, right? We learn to act with it. We experience it, we implement the coping skills, and then we proceed. Phase 3 is really focused on relaxation. So we want to implement skills or learn skills to reinforce that, and then there's repetition. And children are encouraged to practice these skills at home, pull the parents in so that they know, what skills have been learned and how they can help reinforce that at home. And then we discuss and we move forward. Okay, so I've also added some additional resources that can be utilized. So Performed Care honestly has a ton of information about services for children with emotional and behavioral difficulties. And so I've listed their contact information. They also have a family hotline. Second floor is a confidential and anonymous helpline for youth and young adults, and it can really help find solutions to problems that children face at home, at school. They're open 24/7. And then Carrier Clinic, they also provide services and educational groups for children ages 4 to 12 years old. Okay. And now I'll open the floor for questions, comments.
So if during the questions, again, you can just keep your videos off and you can unmute yourself, or you can put the question in the chat box. That would be great. Also, just a reminder, if you can complete the, like if you didn't have any questions and you don't want to stay right now, if you can complete the Survey Monkey for the evaluation, I put the link in the chat box. Again, we really appreciate that because we get suggestions for future programs and we want to hear what you thought about the program. And this video will be posted in probably about a week. And so that second link that I have up is for capitalhealth.org/community ed. That's for watching the video after it's, after our social media person use it. So thank you very much. And yes, if people have questions, I don't see anything in the chat box, but you're more than welcome to raise your hand or turn your mute on. Well, Tatiana, you want to wait a little bit longer just to see if we get any questions? It's up to you.
Okay. Well, if there aren't any questions and there was anything that anyone wanted more information on, that's also an option.
Oh, here, one just popped up. What if you are working with a child who has severe anxiety and the breathing techniques don't work?
Okay, so in the event that the breathing techniques don't work, I would encourage distractions, healthy distractions, something to kind of redirect their train of thought. So to do that, I would encourage in moments where your child is not activated to kind of gather some resources, internal or external, and that could be literally anything, favorite shows, favorite toys, scenes, activities that they might be willing to do during that moment to kind of detach from whatever that feeling is or those anxious feelings. You're welcome.